guys, and welcome to How to Gastro. In today's video, we'll be talking about a very interesting topic, and that is pancreatic cancer. So let's get started. So let's begin with a brief introduction to the disease. So cancer of the pancreas is the fourth leading cause of cancer deaths worldwide. It accounts for 6% of all cancer-related deaths, with a collective mean survival time of about 4 to 6 months. Pancreatic cancer is difficult to diagnose in its early stages because it usually remains asymptomatic at first. By the time the patient is actually diagnosed, almost 52% of them have distant metastasis and 26% of them have regional spread. So from this brief introduction, we get that pancreatic cancer is the fourth leading cause of cancer deaths worldwide, and it's actually very difficult to diagnose because at first the disease is pretty asymptomatic. And it also has a very poor mean survival time, which means that a lot of the patients don't actually make it after the diagnosis of the disease. So now let's take a closer look at what pancreatic cancer actually is. So what is pancreatic cancer? Pancreatic cancer occurs when healthy cells in the pancreas stop working correctly and begin to divide out of control. These cells can build up and form a cancerous mass called a tumor. The tumor is malignant, meaning it can grow and spread to other parts of the body. As this tumor grows, it affects the function of the pancreas, causing the organ to fail. The tumor may also invade nearby blood vessels and organs and eventually spreads to other parts of the body through a process called metastasis. So by definition, pancreatic cancer occurs when we have these cells within the pancreatic organ which begin to divide in an uncontrolled manner, and they produce this mass which is called a tumor. And this tumor is not basically just confined to the pancreas itself. As it grows and enlarges, it also invades nearby structures, such as the small intestine, the biliary ducts, etc. But it can also metastasize to other parts of the body, such as the liver, the abdominal wall, the lungs, the bones, or even lymph nodes in other regions of the body. So now let's discuss a few words about the pancreas. So the pancreas is essentially made up of two main parts. It has the exocrine part and the endocrine part. So the exocrine part of the pancreas is made up of ducts and small sacs called acini, and these sacs make up specialized enzymes called amylase and lipase, as well as protease, which are released into the small intestine to help the body digest and break down the food we ingest. So if we take a closer look at this image on the right side of my screen, we see that this is actually the exocrine part of the pancreas, and it's made up of these ducts and small sacs which actually produce specialized enzymes called protease, lipase, and amylase. These actually help in the digestion of the food we intake. The endocrine part of the pancreas is made up of cells called the islets of Langerhans, and these cells are very important and make specific hormones, most importantly insulin. Insulin is a hormone that helps control the amount of sugar in the blood. This portion of the pancreas also makes other hormones such as glucagon, somatostatin, pancreatic polypeptide, and vasoactive intestinal peptide. And each of these hormones also play an important role in regulating the body's metabolism. So we have the endocrine part of the pancreas, which is made up of these islets of Langerhans, and they are important in producing insulin, glucagon, and somatostatin, as well as other hormones which regulate the blood sugar and also play a role in regulating the body's metabolism. So actually, the pancreas is a very important organ with various functions in the body. So now that we know the two main parts that make up the pancreas, let's take a closer look at the types of pancreatic cancer. So pancreatic cancer may occur in any part of the pancreas. So depending on where exactly the cancer began, pancreatic cancer is essentially divided into two main types. So we can have exocrine pancreatic cancer, which is the most common type, or we can have endocrine pancreatic cancer. So the exocrine pancreatic cancer will affect the acini and ductal tissue, and the endocrine pancreatic cancer will affect the islets of Langerhans. So now let's briefly talk about the exocrine pancreatic cancers. So the exocrine pancreatic tumors can be benign or malignant. The benign tumors are also called cystadenomas and make up a very few of the exocrine pancreatic tumors. The majority of the exocrine pancreatic tumors are malignant. Some of the malignant exocrine pancreatic tumors include adenocarcinomas, which typically start in the gland cells in the ducts of the pancreas. We can have the acini cell carcinoma, which starts in the pancreatic enzyme cells. We can have ampullary cancer, which starts where the bile duct and pancreatic duct meet the duodenum of the small intestine. We can have adenosquamous carcinomas, squamous cell carcinomas, and giant cell carcinomas. So these all essentially make up the malignant forms of the exocrine pancreatic cancers. Endocrine pancreatic cancers. So the endocrine pancreatic tumors are also called neuroendocrine or islet cell tumors. And the name of the tumor depends on where the cancer starts, meaning on the type of hormone-producing cell. So endocrine pancreatic tumors include insulinomas, which are insulin-producing tumors, glucagonomas, which are glucagon-producing tumors, gastrinomas, which are gastrin-producing tumors, somatostatinomas, which are somatostatin-producing tumors, and VIPomas, which are vasoactive intestinal peptides, or VIP-producing tumors. So now let's talk about some signs and symptoms of pancreatic cancer. So signs and symptoms of pancreatic cancer usually don't occur until the disease has reached an advanced stage. So if you remember in the first slide, in the introduction of this topic, we discussed that these patients don't usually have a very good survival rate because they are usually diagnosed only in advanced stages of the disease. And that's because most of them remain asymptomatic in the beginning stages or in the first stages of the disease. So once signs and symptoms do occur, they may include abdominal pain that radiates to the back, a loss of appetite or unintended weight loss, the yellowing of the skin and the whites of the eyes, which is called jaundice, light-colored stools, dark-colored urine, itchy skin, a new diagnosis of diabetes or existing diabetes that has become more difficult to control, blood clots, and fatigue. So what are some of the risk factors in the development of pancreatic cancer? So some of the risk factors include smoking, diabetes, chronic inflammation of the pancreas, which is called pancreatitis, a family history of genetic syndromes that can increase cancer risk, including the BRCA2 gene mutation, Lynch syndrome, and familial atypical mole malignant melanoma syndrome. Also a family history of pancreatic cancer, obesity, and older age, as most of the people diagnosed are actually over the age of 65. Diagnosis. So imaging tests such as ultrasounds, computer tomography scans, magnetic resonance imaging scans, and sometimes position emission tomography scans can help visualize the internal organs and show the presence of tumors in the pancreas. We can also do a biopsy, which means removing a tissue sample for testing. So here the biopsied sample is then examined under a microscope so that the nature of the cells there may be assessed. And we can do a blood test, and this can help us look for specific proteins, which are actually called tumor markers. These tumor markers are shed by pancreatic cancer cells. So one of the most common tumor markers in pancreatic cancer is called the CA19-9 test. And this is actually a specific tumor marker in patients who suffer from pancreatic cancer. And finally, treatment. So the three treatment options in pancreatic cancer is surgery, radiation therapy, and chemotherapy. Surgery, this can be done to remove all or some parts of the affected pancreas, and this procedure will eliminate the original tumor but can't remove cancer that has spread to other portions of the body. Therefore, surgery will not be suitable for patients with advanced stages of pancreatic cancer. We can also do radiation therapy. Here, X-rays and other high-energy beams target the tumor to kill cancer cells. And we can also try chemotherapy. Here, cancer-killing drugs can help prevent the future growth of cancer cells and can actually shrink the cancer cells which are already formed. And that brings us to the end of this video on pancreatic cancer. Thank you guys so much for watching. Please make sure to like, comment, subscribe, and share. Hope you found the presentation very interesting and informative. Please make sure you turn on your bell notification so you'll be notified every time we have a new upload. And if you would like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.